Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Newsroom. I'm your host, Khalid. But it is the 27th of July 2021, and these are the stories that we will be talking about during the course of our show. We will begin, ladies and gentlemen, with the fourth wave of COVID that is, of course, affecting other countries in the world, including in Pakistan. There are different hospitals in Karachi that are full to their capacity, so much so that the Ruth Fao Civil Hospital, Karachi, has halted all its key functions, the operations and other procedures because of the number of patients that are admitted due to COVID-19. 3,000 COVID cases for the second straight day, 3,262 cases in the last 24 hours, and of course the positivity ratio is 6.6%. Most of the cases are from Sindh, then from Punjab and Khyber Pakhtunkhwa and Islamabad. The number of cases are increasing as we speak. We have been told that if we do not follow the SOPs and do not get ourselves vaccinated, that this will become a very important wave of the COVID-19 which will impact everybody in Pakistan. Violence against women, and what are the ways and means that need to be taken by different sections of the society, the administration and the judiciary in order to curb such practices from happening in the future, and how can we empower women from also standing up on their own feet and addressing such issues in a manner that does not impact them before it gets too late. This is going to be our third segment. It concerns COVID-19, coronavirus. We've been talking about this pandemic since more than a year now, and we have been talking about the different waves that have been impacting the world, including Pakistan, and now as per the reports, the fourth wave is impacting Pakistan mainly because of the Delta and the Delta plus variants or the Indian variants that have come from India directly and indirectly. Now, to talk about what needs to be done, what has impacted this fourth wave to Pakistan, and what are the measures that need to be taken by different sections of the society. We've been joined by Rana Jawad Asghar Saab. He's a leading epidemiologist. Dr. Saab, thank you very much to have joined us. So when we see the positivity ratio in the last 24 hours, it's 6.6%, slowly and steadily gaining momentum. The number of cases are also increasing, so much so that in Sindh, there is more or less an emergency with the different hospitals that are more or less full with the patients of COVID-19. What happened? What led to this increase in number of the cases?
And I think if you look at from the other side,
Dr. Saab, I can't hear you properly. If you could kindly just have a look if everything is all right at your end.
yes, can you hear me now?
Yes, but we can hear you very, I mean, it's not as, the voice is not as sharp as it should be. Dr. Saab, all right, anyways, the fourth wave of COVID-19, Dr. Rana Jawad Saab, is impacting Pakistan. What led to the fourth wave entering Pakistan, and why are the number of cases increasing at such a steady pace?
I think if we look at 4 weeks ago, the numbers were low, and our positivity rate was also less than 2%. And within less than 4 weeks, we have jumped to around 7%. And that's very alarming. That not only the numbers from less than 1,000 have jumped to close to 4,000 yesterday, but also the positivity has been not only doubled, but sometimes like 4 times. It has gone up around twice, I think. So what happened? And if you remember, we discussed about this before Eid also. And the problem is that if people start believing that pandemic is over, and many of us want to believe in that pandemic is over, we have done whatever was required for 1.5 years, and now people start to assume things are normal. But the virus has not ended the war yet, and actually it is producing its different variant, and its current variant, which is Delta variant, is highly infectious. It is 200% more infectious than its previous variants, and every country it goes, it quickly replaces the previous variants and dominate the virus in that country. So if we look at
Dr.
UK,
Saab, also, I've heard that this Delta and Delta Plus variants are not detected by the different PCR tests and the other tests that are conducted to know and ascertain whether you are positive from this virus. Is that true?
so every time a new variant comes, sometimes you have to realign your PCR testing procedures, the methods to make sure that you can pick it up. Uh, you are very correct that many patients I personally know, their PCR tests were negative, but every other indicators of a corona infectivity was with them. And the principle, whenever there is a pandemic or epidemic, is this: we don't care about the test results, but treat the patient as if he or she has the symptoms of whatever the disease is going on, assume that the person has that infection and treat accordingly. So that's why I'm also using your forum, want to tell to general public that if you are having a sore throat or you have a runny nose or a fever for a few days, assume that you have a coronavirus and isolate yourself. Because it's not typhoid, it's not going to be flu. The number of cases of flu last year have been negligible. You need to understand this, because the precautions we were taking for corona has also cut down the flu infection. So most probably, if your city has coronavirus infection, then if you have those symptoms, assume it as a coronavirus infection and self-isolate yourself to protect your family members. Because if you are not going to
Jawad,
do it,
what happened to Karachi? Why is there such a high positivity rate in the city? What happened? I mean, why are the people not taking sufficient care? Are there other issues that have led to this increase in the number of cases?
Multiple factors, and mega cities are always susceptible to any major infectious disease, because people are living in close quarters, and there are more people per square kilometer as compared to any other place in Pakistan. So Karachi was vulnerable from the day one for any major, the surge or the wave. And I was happy that until now, Karachi was managing pretty well by testing a lot of coronavirus. If you remember, sometime in the early phase, Karachi or Sindh was testing 40% of all the tests which were being done in Pakistan, even though their population was 25%. So that was a good strategy. But I think now the coronavirus has reached out to them. They have come up with the announcement of restrictions. But my advice to provincial governments is that don't wait for something to happen. Do preemptive. You have to outsmart the virus, but not to follow the virus lead. So if there is a risk, then we need to come up with some restrictions before we see the spike of cases. And once you see the spike of cases and pressure on hospitalization, it's pretty much difficult then to control it in a few days.
Because Dr. Saab,
Then
we
the
saw the
virus has gonna
Delta
take
variant, what happened and how it wreaked havoc in India, and how the people were dying inside their cars on their way to the hospitals. And even in Karachi now, as per the reports that we have received, is that a number of hospitals are full to their capacity or almost full to their capacity with patients that are suffering from COVID-19. Which brings me to another very important question, that is vaccination. It has two folds, this question that I'm trying to ask you. A, is any vaccination important, or does it help you to prevent yourself from this variant of COVID-19? Because as per the latest reports, some say that Sinopharm is very effective against the Delta variant. Others say that even Pfizer is only 40 to 41% effective against this variant of COVID-19. What should one do then?
Get whatever vaccine is available and get yourself vaccinated. That's a simple, clear message, and I'm giving this whenever, by the time we got the vaccines. Don't wait for a good vaccine. And just to remind people that until now people were saying that Pfizer is the best vaccine, but some reports have come up that it's not faring well against Delta.
Exactly, 40 to 41%.
So every vaccine had its limitations, and challenges whenever there will be a new variant. So there will be no perfect vaccine. So again, my advice to everyone is, and I know a lot of people are waiting for a good vaccine to come and be available. That's actually they are playing with their lives. Not only playing with their lives, but they are playing with their family members, their elder family members' lives also. Because if they get infected, probably they're going to infect their elders also and put their lives at risk. And the other thing in the Delta virus, which we are seeing is because it's so infectious that once it infects a person, many times the whole family get infected. Like parents will get infected, their kids will get infected, and like the whole family will come as infected instead of 1 or 2 person. And for that, my advice to the people will be that if you even have a slightest hint that you have a sore throat or a running, you're starting to feel a running nose, self-isolate yourself. And if
Exactly,
you can't
that is very
self-isolate
important. But there are so many other
yourself,
symptoms, Dr. Saab, that are different from the other variants of COVID-19, like stomach upset, something that resembles typhoid fever as well. There are other symptoms as well that are a bit different from the symptoms of the alpha variant or the other variants of COVID-19 that are available. Last question, Dr. Saab, SOPs, standard operating procedures, something that we've been talking about in different shows over the last more or less 2 years. People are still not following those, especially now some who have gotten themselves vaccinated think that they are above and beyond the others and there's no need to follow the SOPs. What message would you like to give them?
No, even if you are vaccinated, but people around you are unvaccinated, and there is a lot of virus around you, you can still get reinfected, or get infected with even vaccine. And we have seen those a lot of cases, and actually, one death in which a person who was fully vaccinated died of this disease. So we need to take this disease seriously. But for the SOPs, mask is just one component of it. My other request, which is easily doable, but no one is doing it, is to open the window and door. Use the ceiling fan, use the pedestal fan, whatever fans you have available. Make sure that the fresh air is coming into that indoor space, and there is, because once you do it, you will decrease the chances, the risk of transmission of Delta virus up to 15-20 times. I'm not saying percent, I'm saying 15-20 times. That's a huge exactly. Protective effort. So fresh air is biggest help at this, which is available to us alongside masks and alongside avoiding crowds. So we need to think about those 3 things and try to implement as much as we could to safeguard our lives.
Thank you very much, Dr. Rana Jawad Asghar, leading epidemiologist from Pakistan, of course, talking to us about the 4th wave of COVID-19 that is impacting different countries of the world, including Pakistan. The number of cases are increasing very quickly, as we can see, and from what is happening in Karachi with the different hospitals that are more or less saturated with the COVID-19 patients. We not only need to get ourselves vaccinated, we also need to follow the SOPs. It is pertinent in this day and age, and especially with the Delta and Delta Plus variants that are affecting Pakistan. The other segments coming up after a short break. Stay tuned. Welcome back. You're watching Newsroom. Our next segment concerns violence against women. This is a global phenomenon, but of late we've been hearing of different cases that have been happening across Pakistan. Swift justice is needed whenever it concerns women and violence against women. A lot of segments of the society are talking about it in the case of Noor Muqaddam and many other cases that have impacted our society and have deeply affected us. More in the following report.
It's a very sensitive issue which needs robust discussion and announced measures to combat its widespread occurrence. The gruesome murder of Noor Muqaddam, heinous murder of Kuratulan and cold-blooded killing of Saima within short span of time rekindled national debate on instances of violence against women and ways to combat it. Gender-based violence can take a number of forms, including psychological, financial, physical, and sexual abuse. Owing to the social stigma attached with gender-based violence incidents, many such occurrences went unreported. In Pakistan, non-reporting, scant media coverage, and a flawed criminal justice system make it appear as though domestic violence is almost non-existent. Meanwhile, absence of consequences reinforces abusive behavior in men who continue to operate with impunity, whether in public or inside their homes, taking refuge in social attitudes and poor law enforcement. Though helplines at the provincial and federal levels are operational, the issue is about awareness and access. In March 2020, the Ministry of Human Rights Helpline received only 13 gender-based violence-related calls. Most rural victims are not aware of what gender-based violence means or how to report it, and hence the majority of women accept domestic violence as a part of life. Furthermore, in our society, both state-run Darul Amans and NGO-run shelters administered are confronted with a trust deficit. Making shelters a safe option requires increased state ownership, financing, and community partnership. Apart from cultural renaissance, robust legal regime is necessary to increase probability of punishment for transgressors. It is also pertinent to mention that without reliable data on domestic violence, no state can respond appropriately, and therefore more transparency in reporting should be encouraged.
Now, to talk about violence against women globally and especially with context of Pakistan, we've been joined by Justice Retired Jamila Jahan Noor Aslam. She's a legal expert and a human rights activist. Thank you very much, ma'am, to have joined us. Ma'am, we've been hearing of so many cases, the latest being that of Noor Muqaddam. When we look at the United Nations Women website and the 10 ways you can make a difference safely and impactfully as far as women are concerned and ending violence against women are concerned, there are a lot of important points that have been put forward. There's also the helpline that has been put into place by our government since last year. The number is 1099. Why aren't women reporting such cases to this helpline? What is happening? What is impeding the women from seeking justice?
First of all, hi, and thank you for having me on the program. It's an honor. To answer your last question first is, yes, there are laws for women, and you asked what is impeding the women from reporting using their helpline. There are two reasons. One, it's cultural. The girl is beaten up. She's locked up in her room. She has no access to communication. And when she comes out, she's threatened that she will, if she ever reports to anybody, then their family will be dishonored and blah, blah, blah. The other thing is that there is not enough awareness. And this is where I will hold the media and the state responsible. The state-owned media itself, or even the private channels, should promote these things and create the awareness. PTV has the largest outreach to the people. Most of the people have PTV. Now, this is a state-owned, PTV state-owned. They should
and
emphasize
we are talking on
this.
the topic right now with you.
Yeah, you are. But how often? You see, there could be teleps running for that in Urdu and English and all the languages. It's a constant thing. We have to change our mindset. We have to empower those women to get up and report crimes against them. The other thing that I find very, you see the Noor case is being reported. The Usman Mirza case was reported. The funniest thing was a few days ago, a couple of weeks ago, I was on PTV, and that was the day Usman Mirza had sent out a video. It had become viral that I've been granted bail, which is a lie because I was in the courts that day, and the media was there. He was brought for the remand. Now, if he's it was the media's duty to show that he has been brought and he's been given official remand. Now, there are two things to a case. First will be the bail. In this case, too, it's quite possible, though I personally, if I were a judge, I would not give that man a bail, this Noor's murderer, because he's unstable, okay? And there is a ward for unstable people in the prison. They can put him there for drug addicts and things like that. Now, what happens is the media report that he's been bailed out, and the people in the ignorance think, oh, yeah, he's been let loose. He's been acquitted. He has not been acquitted. The bail is one thing, the trial is another thing. Now, what happens is the media reports the occurrence, maybe even the bail thing, but they never report what happened at the end of the trial. The only case which I remember, recent case, is Zainab's case.
Trying to say that the media needs to have a much larger responsibility and a more crucial responsibility as far as talking about such incidents are concerned. Of course, some of these cases are sub judice, so we cannot talk in detail about that. We'll be coming back to you with more detail on this in a more detailed program. But till then, thank you so very much, Justice Saiba, to have talked to us and to have enumerated your point of view as far as violence against women is concerned.